I'm Doug Gosling. I'm 58 years old. I was diagnosed with prostate cancer about 9.5 years ago. My cancer has subsequently come back and metastasized, and I'm now under palliative care. It was actually on my birthday, and the doctor told me I had 12 to 18 months to live at that point in time. So very quickly at that point in time, I felt I had a decision to make. And I made the decision that I was not going to do any more treatment whatsoever. I didn't care, what new drugs might be coming down the pipe or clinical trials. I felt that if I had that small amount of time, that I wanted to concentrate strictly on quality of life and enjoy the time that I had. Making the decision to discontinue treatments is very difficult on many levels. It's a complex question because it's not just you that you have to think about. I always worried that, maybe Diane felt that I wasn't fighting hard enough, or that somebody else might thought I was quitting or something like that. And not that that should bother me, but it does bear, I think, to some extent on the decision. And I think peer pressure, family pressure can affect people like that. It didn't with me. My family, and Diane especially, been very supportive in this decision, and I've been, very pleased with their reaction to it. I've been allowed to kind of make that decision and live my life the way I wanted to, and we've really made the most of it. And in terms of fighting, I fight this cancer every day. I don't, for the life of me, think I've ever given up. I fight side effects. I fight the pain. I fight the this whole idea of not doing treatment. It's with me kind of every day. I try not to second guess it, but it's there. When you make a decision like this to discontinue treatment and then take the next step to sign a DNR and go on that path, it can be, for me it's been a great relief, because for me it's all about acceptance. I know a lot of people have difficulty with the idea of dying. I have difficulty with the idea of dying. I don't want to die. I don't like the fact that I'm dying, but I know I'm dying. So all I can really do is work with what I have. So once you can accept the fact that that's what's happening to you, then you can move on and you can make these decisions that are right for you. So for me, it really, in a way, lifted a great weight off my shoulders. I don't have to worry about this anymore. I'm not looking over my shoulder anymore. But I can see how other people would. I really do. And I think if somebody told me that I had a 5% chance, I think I would find that very hard to deal with. Because you'd always be wondering, well, should I do this? Should I not do this and that? But the doctors are saying, no, this is it. You're just going to get tireder and tireder and tireder, and then the last couple of weeks you're going to be really sick and you're going to die. And I have to live with that and die with that, I guess. It's critically important to talk about these things amongst your family members, those that are close to you, particularly your spouse. These decisions aren't just about you, they're about everybody around you. We all have to live with the decisions that I have to make, and we all have to be comfortable and happy with them. And I can't imagine me making a decision that went completely against the grain of the way my family felt. And the only way to really avoid that is to talk about it. It is so critically important to talk about what's happening to you. I think it's important to talk about death generally. It's a reality. I'm going to die. There's no getting around it. There's no 5%, 10% chance out there, and unfortunately I don't believe in miracles. So it's going to happen, and we need to talk about it. And I've been very lucky because my family has always been very open about it. And Diane and I in particular have probably, I think, one of the most open relationships I've ever witnessed myself in terms of being able to talk about this ever since I was first diagnosed, 9.5 years ago. And to be able to talk about it openly and to make decisions but considering all the different facets has been absolutely incredible. And when you come to, what kind of decisions you have to make, making the decision to stop treatment is just really the first. And in some cases, it's not even a decision because there may be no options. But from then on, there's a whole series of decisions that have to be made. And some of them are kind of obvious. Sometimes you have to think about, simple things like, am I going to be cremated, or where am I going to be buried? Those are some of the things that come to mind. But there's all sorts of things like wills that you have to worry about, and powers of attorney, and what about finances, and there's all those practical things you have to talk about, and you can't avoid them. They have to be talked about. Hope is such a very important thing for everybody to have. I mean, it's one of those life-sustaining things. We all want to live, and when you're faced with an illness, clearly the first hope that you have is that you are going to live. But that hope changes over time. When I was first diagnosed, I thought, well, I'm going to have chemotherapy, I'm going to have surgery, I'm going to have all sorts of radiation, and I might die. And these are all these things. I didn't know what was going to happen to me, so I could only hope. And then as I learned more and more about the disease, I started to know what to hope for. I hope for a low PSA, I hope for this finding and that finding, and you sort of start chasing those hopes, if you will. And then as time goes on, in my case, as when the cancer metastasized, hope changed. I lost the hope that I was cured. It disappeared as soon as it came back. And that's when you start thinking more, I think, about the direct impact on you. As it gets closer and as the time frames shrink, then you start worrying about things like pain. How sick am I going to be? Am I going to be completely bedridden? Is my back going to break and I'm going to be, not be able to move for the last 2 years of my life or something like this? And that kind of hope that this isn't going to happen to me becomes very, very important. And then for me, I reached a point where almost at the same time where I could sit down and I could just say, this is what I hope for. I hope for no pain, and I hope to be not too ill when I die. I'd like to just kind of plateau, and then last couple of weeks or something, just that's when I'll break down or whatever. But there's other things I hope for. I mean, for me, that's hoping for what I would call a good death. But I also then I have hope for my family. I hope that the impact isn't. It's hard to say that. I hope the impact isn't that great on my family, although I know it will be. But I can hope that they're able to cope, and in particular Diane, that she's able to cope with what's going to happen, because it's not going to be easier for her. So my hope. A lot of my hope has shifted to her, that I have hope for her to be able to get past it as best she can, and to build a new life, and to be able to move on without having me around. And I think about that a lot.